We're speaking with Isaac Kohane, Harvard Medical School. He's a speaker dealing with artificial intelligence. So thank you for joining us.
My pleasure. What's your question?
Is it good or bad, artificial intelligence in medicine?
Compared to the current state of medicine, it's good.
And compared to in general?
It's a new partnership. We'll see what happens.
So tell us, how is AI changing the medical industry?
First and foremost, it's giving patients an instant second opinion. If you're being seen by a doctor and they say something to you, you can now immediately go and say, does that make sense? And you don't have to worry about embarrassing yourself, even though it might not be embarrassing, with a doctor and saying, can I ask another doctor about this? You can ask, is this the right treatment for my cancer? Is in fact the diagnosis correct? And I can tell you all too many examples where patients are now empowered in ways that they previously were not, going without diagnosis for years.
How do patients tap into it?
Literally, almost every browser now. When you use Google now, when you use Bing search, you have an AI right there. It's imperfect, it sometimes lies, it hallucinates, but compared to the healthcare we have today, pretty good.
But also used to diagnose patients too, right? You can just take a scan of somebody's condition and it can come up with problems that might exist that the doctor didn't pick up.
Well, it's for some things it's doing pretty well, but I'd say for a lot of the sophisticated imaging things that we do in medicine, it's not there yet. But here's the interesting thing about AI. Unlike doctors, which take maybe 10 to 15 years to train, these AIs improve every year. And so it could be that in 2 or 3 years, any imaging that we do in medicine could be done, and it could be expertly interpreted by AI.
Thank you for sharing with us.
You're welcome.